Today, Cone Health started back some elective surgeries and procedures, and in today's To Your Wellbeing, we are breaking down how they are keeping safety top of mind. And so for today, we have Cone Health's Chief Operating Officer, Dr. Mary Jo Cagle, and Moses H. Cone Memorial Hospital Chief Medical Officer, Dr. Jay Wyatt, joining us. So, Dr. Cagle, let's start off with you. First and foremost, what is and what has gone into the decision into making that ability to start offering elective surgeries and procedures once again?
Yes, so first of all, we had to take into account the guidance of the state. So we listened very intently to what Secretary Cohen and Governor Cooper stated in their comments at the beginning of last week. So we're very attentive to that, as well as what our federal government and national societies like the American College of Surgeons had to say in their guidance to us about going back to surgery.
All right.
We also,
okay, go ahead. Go ahead. I just wanted you to expound on that a little bit about what the key elements to determine when it's time to start all that.
Right. So the guidance talks about looking in our community at what the cases of COVID look like. So we are looking at, have we stopped increasing in cases, or have we plateaued or started to go down? As we talked about last week, we've seen a plateau of cases. We also are looking at what is what we call the reproduction rate of the virus. In other words, is the number of cases increasing rapidly, or is it starting to slow down? And we are seeing that it is starting to slow down in our community. We also have to look at, can we provide care in a safe environment? Do we have enough protective equipment for our employees, enough masks, enough gowns? The answer to that is yes. Do we have enough tests? The answer is yes. And can we create an environment that has the right cleanliness, enough social distancing, that we can invite our patients in, and a support person who would care for them so we could give good instructions? And if we can answer yes to all of those questions, then we can invite them in. And also, for patients who do have COVID, can we care for them in a place that is separate from where those patients who are coming for surgery are coming? And as you know, we have the Green Valley Hospital, which we're glad to say we can provide care in a safe and wonderful manner for patients who have COVID-19, which is totally separate from where we're providing the surgeries. So those were all hurdles, if you will, that we needed to be able to cross to be able to offer surgery. And so when we were able to say yes to those things, then we could say it's time to move forward with surgery.
Gotcha. Okay, so a lot of different elements. You heard all the different elements from people who are going in for elective surgeries and procedures, all the way to how do we keep the people who are sick with COVID-19 also getting the care that they need to, and also protecting the healthcare workers. So that is hey, we don't just open up the floodgates and let it all happen. There's a phased in approach there. So Dr. Wyatt, can you tell us about that?
Absolutely. So as you probably remember, about the middle of March, we abruptly shut down our elective and non-urgent surgical cases and other procedures. In order to get it back up and running, we can't just open the floodgates and overwhelm our staff and our resources and start doing everything right away, including increase the backlog of cases that we've accumulated over that period of time. So the phase-in approach is to first try to hit that backlog of cases. We're going to open up our ambulatory sites first. And as we slowly increase our production over time, we will go up to about 100% and even above 100% in about 3 to 4 weeks. But in order not to overwhelm our resources, our personnel, and our sites, we want to do this fairly slowly.
Gotcha. But thinking that it could be at 100% by 3 or 4 weeks to me seems pretty quickly to be able to rebound, which is great. What should people do if they were previously scheduled for surgery or a procedure? Should they contact their provider? Should they wait for their provider to contact them?
I think our providers have done a really good job of placing priority on those patients that need to be done sooner than later. And so they probably have already contacted their patients that have been postponed and trying to get them back on the books. So I would give them a week or so to get a phone call from their doctors. And if not, then they may just give them a call to see. But most of them have done a really good job of already reaching out to that patient population.
Yeah, that's a lot of wheels, again, to be turning all at the same time to get everybody up to speed. But it's great to know, especially for people who were waiting for those procedures and that kind of thing, that it won't be too much of an extended period of time. All right.